Preventing Prescribing Errors, a guide to writing safe and complete prescriptions. My name is Deborah Feinberg. I am the Executive Director of the New York State Council of Health System Pharmacists and an Assistant Adjunct Professor at Albany College of Pharmacy and Health Sciences in Albany, New York. I have a Bachelor of Science in Pharmacy and a Juris Doctor. Funding for this guide was provided by HRI through the New York State Department of Health Patient Safety Center as a result of a settlement by the New York State Attorney General and Cardinal Health. Complete and accurate prescribing is an essential component in the prescribing process, thereby reducing medication errors and preventing adverse drug reactions. Minor omissions impact the pharmacy's ability to fill prescriptions, causing a delay to the patient's ability to begin appropriate medication therapy. This session is intended to provide a brief overview of the prescriber guide and to highlight key aspects of prescribing. Handwritten prescriptions are prone to error and misinterpretation. When available, consider utilizing electronic prescribing systems. It is important to understand that there are different requirements for prescribing controlled substances. Therefore, it is important to know what drugs are regulated as controlled substances and the schedule of the controlled substance. All prescription blanks should contain the prescriber's DEA number, license number, and MPI number. Residents who are unlicensed will use the institution's DEA number with a unique 3-digit identifier attached as a suffix. The prescriber's address and phone number is required as well. All prescriptions should contain complete patient information, including patient name, complete address, date of birth, age, gender, weight, especially for pediatric patients, and the date the prescription is written. The RX section, or script, should contain complete drug information, including drug name, strength, dosage form, quantity, the SIG, or directions for use, and the indication. New York State has a unique feature on the prescription blank for designation of a brand medication. If the prescriber or patient desires branded medication, the prescriber must write DAW in the box on the prescription indicating dispense as written. For Medicaid branded prescription, the prescriber must write brand medically necessary. The prescriber's signature validates the prescription. Refill instructions must be written in alpha and numeric to prevent alteration. The use of PRN is discouraged. However, if used, only one refill is allowed. Controlled substance prescription requirements include all of the requirements listed for non-controlled prescriptions. A DEA number must be included on all controlled substance prescriptions. Only prescribers with a valid DEA number are authorized to write for controlled substances. The patient's address must be complete on the prescription, cannot be pre or post dated. Prescriptions need to be written at the date and time of service. MDD, or maximum daily dose, is required on all controlled substance prescriptions. A 30-day supply or less is permissible unless the prescriber authorizes a greater quantity by indicating a code or the diagnosis that coincides with the patient's condition. No refills are allowed for Schedule II controlled substances and benzodiazepines in New York State. All other refills are limited to 5 refills within a 6-month period of time from the date the prescription was written, provided the prescriber has authorized refills. Medicaid requires an NPI for all claims. For all durable medical equipment, prosthetics, orthotics, and supplies, Medicaid requires a diagnosis code. All Medicaid prescriptions expire 6 months from the date written. Medicaid prescriptions may be written for either a 1-month supply with up to 5 refills in 6 months or a 90-day supply with 1 refill for many chronic medications to expire 6 months from the date written. Additional controlled substance instructions include a prescription cannot be written if a patient has more than a 7-day supply of the medication from any previously filled prescription for the same drug, quantity, strength, and dosage form. Prescriptions are valid for 30 days from the date written, not from the date that the patient fills the prescription. For coded prescriptions, quantities greater than 30 days may be prescribed. One refill is allowed on all controlled substance prescriptions for a 3-month supply, except C2s and benzodiazepines. A 6-month supply of anabolic steroids is permissible with no refill. The following codes are permissible: A. Panic disorder. B. Minimal brain dysfunction or ADHD. C. Chronic debilitating neurological condition. D. Pain from conditions or disease that are chronic or incurable. E. Narcolepsy. F. Hormone deficiency. The drug must have an indication that matches one of these conditions. If not, then the code will be disallowed. For oral orders, those orders that are emergency, a 5-day supply is permissible for C2, benzodiazepines, C3, and C5. A 30-day supply, or 100 dosage units, whichever is less, is permissible for C4. Written follow-up prescriptions sent to the pharmacy must be done so within 72 hours of the oral order. If no cover for C2 and benzos is received within 7 days, the pharmacist must notify the Department of Health. If no cover for C3 through 5, the pharmacist must make a notation on the back of the prescription that no cover was received. Oral orders are not refillable. Faxed orders are treated as oral orders. For syringes and needles, they are not considered controlled substances. However, they are regulated by the Department of Health. An emergency supply of 100 units is permissible. A written cover must be received by the pharmacy within 72 hours. If it is not received within 7 days, then the pharmacy must make a notation on the back of the prescription that the cover was not received. Written syringe prescriptions in New York State are valid for 2 years from the date written. New York State also has an ESAP program, which stands for Expanded Syringe Access Program, that allows persons 18 years of age or older to purchase syringes and needles in a quantity of 10 per transaction. For pediatric prescriptions, the weight of the patient should be included on the prescription with a notation made on the prescription how the dosing calculation should be made. There are many medical abbreviations that should be avoided, and a list is provided for you. This list is not inclusive. There are also internet links that are provided for you. All of this information is current through May of 2010. References are also provided. For additional information, please contact Darren Triller, who is the Director of Pharmacy Services at iPro.